Hi, I'm Jeff Bloomberg and I'm the Chief Operating Officer at MGE. In this week's tip, we're going to talk about why your new patient numbers have dropped and what you can do to fix them. Now, this tip is part one of three. I do like to talk a lot, but I wanted to make them a bit information packed so that there's a few things you can do back in your office to work on getting your new patient numbers up. Now, if you don't make it to the end of the tip, I again tried to keep it as short as possible. It is Thanksgiving weekend, so I do want to wish you from the entire MGE team a happy Thanksgiving. Hope you enjoy it. And remember, calories don't count tomorrow. It's not really true, but we can at least all wish it was that way. Now, I also want to say that if you would like to do something to increase your new patient numbers, I would recommend two specific MGE services. There's the MGE New Patient Workshop and the MGE Internet Marketing Seminar. I've included a link for both below that you can click to get more information on them and find out more about them. MGE is a training organization. And when I speak with a new client, they may wonder, what does that mean? Well, here's our object. Whether you like it or not, if you own a practice, you are a business owner. If you want to be successful at something, you have to know what it is that you're doing. If you're a dentist, you're trained to be a dentist. You also at least have to have rudimentary training on how to run a successful business. So again, it comes back to training. What does that mean? We teach our clients how to do things themselves so that they can do it from then on for the rest of their career. That's the object here. Now, of course, if someone's learning, they need apprenticeship and help and things of that nature, which is what we do. But my object always is to give a client an ability to be able to do it themselves, whether it's on our new online training platform, which is available for clients now. Eventually, in the new year, it'll be open up to all public, or it's in our MGE course room, or at MGE seminars, or with follow-up that we do with apprenticeship. So what I wanted to do in this video is I wanted to talk about how you can yourself sort of debug your new patients if they've dropped for whatever reason, or at least the actions I would go through with somebody if I saw that their new patients had dropped, at least the beginnings of those actions. Now, how I'm going to do this is in this video, I'm going to talk about what do you do if your new patients used to be, here, and now they're here. All right, we're going to talk about that first. Now, why am I doing a part 2 and 3? Let's say your new patients have always been here, and you want to get them up, or you would like to get your new patients into a higher range than they are now. We're going to also examine that a bit in parts 2 and 3, things you can do to raise your new patients. In order to do this, the first thing we need to take a look at is what is the line for acquisition for new patients? Let's look at each part, because if we're trying to fix something, we have to look at where it could potentially break. So where does it begin? If you're doing any kind of marketing, all right, that's where it starts. You're marketing out into the local area, and what are you expecting as a result of that marketing? Marketing does not produce a new patient. Okay, people don't get your postcard in the mail and instantly materialize in your office. It creates an inquiry. Same thing with a referral. If I refer my friend to your office to be a prospective patient, again, they're not going to magically materialize in your chair. It's going to create a phone call where they're calling your office. So marketing, or even referral marketing, creates a phone call or an inquiry. All right, so that's the first part of the line, which then brings us to the next part of the line, which is that inquiry is fielded by somebody. Reception. All right, reception fields the inquiry and turns that inquiry into a person who's scheduled and actually on the book. Then the person has to actually arrive. All right, now where you start to get into return on investment, once the person's actually there, you get into case acceptance and retention. Does the person convert and do the treatment that you have recommended to them? Because that's going to affect your return on investment. And does the patient stick around for a while, or do they only come that once and never come back? We're going to be addressing all of these things in later videos. But what I want to take a look at here, just in this one, is let's say you've been trucking along at 45 new patients a month, and all of a sudden you have 20. So what do you do? The first thing you're going to want to do is we're looking for change. All right, we're looking for, because at one point we're getting 45, 45, 45, and then all of a sudden we have a drop, especially a sudden drop. We're looking for something changed. What changed? And the areas we're going to look in is with our marketing, and primarily marketing and at reception, or potentially how we're handling things internally. All right, and let me explain. So let's say all of a sudden my new patients have dropped off. The first thing that I'm going to do is look at, am I getting less inquiries, all right, or incoming calls from any of the marketing things that I had going before? Let's say I'm getting patients from a postcard, my website, and some type of Google pay-per-click and referrals. I'm going to examine all those in the prior months. Let's say the prior months I was getting 45, 35, 50, etc. I'm going to look at an average of what I was getting from each of these things in prior months. That's the first thing I'm going to do. Then I'm going to pick up the month that I'm in that's not going well, and I'm going to look at where did it drop off. Chances are you're going to find out that something dropped off. You'll either find one category dropped all of a sudden, in which case you know exactly what you have to address. Maybe the mail didn't go out. I've seen that happen before. People thought the mail went out. Maybe it didn't. Maybe you stopped doing a particular type of a mailer, and all of a sudden you're not getting new patients from that anymore. These are easy fixes, right? If one particular thing drops. All right, now, let's say it isn't one particular thing. Let's say it all just dropped. You went from getting 10 new patients on average from each category of, outreach, and now you're getting 5. All right, well, that's a little weird. So now we're going to have to take a look at what problem is most likely internal. All right, so we're going to take a look at reception. Now, here's what I'm going to look for. Did I change anything having to do with reception? Did I have them do anything a little differently? Did I change receptionists? Did I change the degree of availability for new patients? Maybe I changed something internally where new patients can't come in at any given time and they can only come in at this time or only on Thursdays. I'm being a little goofy, but you get the idea. I'm looking for changes, alterations, something different because what was working before all of a sudden isn't working now. Now, especially if I've switched receptionists altogether, I don't want you to just wholesale decide that that receptionist is a problem. They could be, but the actual problem with a new receptionist isn't always that they're just a new receptionist and they're not your old one. Maybe your old one moved away or whatever. It's that there's something that they are doing that the old one didn't, or there's something they're not doing that the old one did. That's the simplicity of what it breaks down to. There's something changed or different about the way that receptionist is handling incoming calls. Again, this is if we have just a gross general drop-off in new patients from what our old receptionist used to do, or our old receptionist who was effective before has changed something. So we need to find out what changed, all right? Next area is actually getting them in and actually to show up on the schedule. Let's say you take a look and you go, okay, the number of patients that we're scheduling any given month has been the same. We've been getting X amount of calls and this many people scheduled, and that hasn't changed, but our show rate dropped off all of a sudden. Maybe your confirmations procedure changed. I would take a look into something like that. Maybe something else changed. You might go online and find out that your Google Maps is wrong. I've seen goofier things. I had one client, and I'm going back a bit, okay? I've been doing this a while, and they noticed that all of a sudden their new patients dropped off. So we take a look at it. We do exactly what I'm describing to you. He analyzes where everything was coming from, and he noticed, now here's the beauty of this. He did this. I didn't have to be called in to do it for him like some consultant. We trained him how to do this himself, okay? So he did this, and he noticed, my Yellow Pages new patients have dropped off. So he digs a bit, and of course, and this is the goofy thing. We always want a reason for something. So, his staff had an idea, his wife had an idea, his friend had an idea why it had dropped off. So he just digs and looks at the facts, okay? And he finds out that his Yellow Pages all of a sudden stopped attracting new patients. Interesting. His new Yellow Pages, I know Yellow Pages, for you youngsters out there, the Yellow Pages was this big yellow book that you would use as a doorstop. No, I'm kidding. Ask your mom or dad or grandma or grandpa about it, and they'll tell you. Anyway, so with the Yellow Pages, he noticed that the new Yellow Pages came out 3 months prior, and so he pulls it up, and it turns out that the company that published the Yellow Pages, this is before you could get phone numbers for a dime a dozen, they had a specific assigned phone number to track incoming calls. Well, that Yellow Pages had gone bankrupt, and the phone number was disconnected. So the doctor called the company or called the phone company, got that number back, so he couldn't track Yellow Pages calls automatically anymore, but all of a sudden, patients were calling off the Yellow Pages. It was something very simple. So the area you're looking for when you have a sudden drop is what altered? What entered in that wasn't there before, or what went away that was there before, all right? So that's the first thing I would do if my new patients drop off. Now, what I'm going to be getting into parts 2 and 3 is, again, what if your new patients have never been high, or what can you do right now to raise them up a bit? So we're going to be breaking down that whole line, marketing to reception to availability and actually having people in the office. In part 3, I'm going to get a bit into, as I mentioned, return on investment, case acceptance and retention, because that's what makes it valuable for the business in the long term. All right, that wraps up this week's tip. If you have any questions about how to market your practice, I definitely recommend that you attend the MGE New Patient Workshop or MGE Internet Marketing Seminar. The links are below. You can find out more there. And if you like this tip and you'd like to see more like it, please click the subscribe button. You'll be informed as these come out. I'll see you next week for part 2. And in the meantime, if you have any questions about MGE, please check us out online at mgeonline.com or call us at 800-640-1140. Thank you very much.